Hi, and welcome to your Ultimate Smile DVD. I'm Kelly Kay, and I'll be guiding you through this instructional DVD on many techniques used in keeping your orthodontic appliances clean and intact. Now, during your orthodontic treatment, it's important to form a team of patient, orthodontist, and your general dentist and hygienist. Only through teamwork can the ideal results of your orthodontics be achieved. Your cooperation in hygiene, maintenance, and care of your braces and retainers greatly impacts the ultimate smile you can achieve. First, let's go over the basic parts and pieces of your fixed appliances. Your braces are made up of brackets and wires. Additional accessories may be used, such as springs, coils, hooks, pins, ties, chains, and tags. Now, each of these parts has an important role in your treatment, and keeping them clean allows them to work properly and facilitate your treatment to finish in the time your orthodontist has estimated. Braces that are self-ligating, such as the Damon system, reduce the amount of attachments and ties needed, therefore automatically helping you with your hygiene. However, improper hygiene and care of your appliances can lead to breakage of these components. Now, this could result in slowing down your progress and extending your treatment time in braces. Also, acids can be produced by plaque on your teeth caused by poor hygiene, causing breakdown of the adhesives and glues used to hold your braces securely onto your teeth. This plaque and acid will also cause residual marks and white spots after your braces are removed. This is not the result you or your orthodontist has in mind. I noticed that the braces look a little different than what they used to back in my day when I had them. Can you tell me a little bit about that?
This is the Damon system. It's a self-ligating bracket system, and something that it really helps in your dental hygiene during your orthodontics is that it has a door that actually holds the wire against the bracket. That way you don't need all those ties and accessories that give you a lot more things to clean around.
Those ties, that's what I had, and they were not fun.
They accumulate a lot of plaque after each time that you eat, so eliminating those eliminates a lot of extra work.
That's awesome. Now, let's go through the basics of dental hygiene during your orthodontic treatment. Your orthodontist will recommend several items that you'll need to add to your normal tools to use when cleaning your mouth. An ADA-accepted toothpaste with stannous fluoride. That'll help strengthen the enamel as well as prevent white spot lesions, reduce sensitivity, and kill bacteria that contribute to gingivitis and cavities while preventing acid attack from your acids in your diet. A toothbrush with soft bristles. Make sure your toothbrush bristles are upright and replace it when it has excessive wear. A travel toothbrush is great to keep with you when you're not at home. A powered toothbrush is a great addition. A timer will encourage you to brush thoroughly for 2 to 3 minutes. This way, it's unlikely any areas are missed or skipped. An interproximal brush to get under the wire, around the brackets and attachments, and near the gums. A rubber tip stimulator to clean near your gums, especially around your braces or bands and their hooks or attachments. Floss and a floss threader. Use 18 inches of floss and a floss threader to get the floss under the wire and between the teeth. Superfloss by Oral-B is an all-in-one product to help you in this step of your cleaning. An automatic flosser may also be recommended to help you get between your teeth and appliances. A mouth rinse with fluoride to rinse away any loose debris and food particles in your mouth, like Crest Pro Health Complete, also alcohol-free. A disclosing agent to highlight areas that you may have missed during brushing. This allows you to see where you need to concentrate more in your brushing and flossing. A patient mouth mirror to help you inspect your cleaning and brushing. Now, Crest has actually put together a handy-dandy little kit for you to help you clean, right?
Exactly. It's called the Orthodontic Essentials Program, and it's several of their products that they recommend for cleaning with braces, as well as a grading card that you can use in your office to teach your patients about brushing. One of the cornerstones of it is the Crest Oral-B toothbrush, and what it's paired with is the Smart Guide. What we use this for is a timer to watch how you're brushing throughout the arch. It starts with a quadrant area that shows you need to start on your upper right and brush for 30 seconds. It'll give you a signal when you're ready to drop down to another area and brush on around. And that way, it'll keep you brushing for a good 2 minutes.
That is so cool. It just automatically starts when the toothbrush turns on?
And you can carry this with you. Just keeps you on time of how long you're brushing in each quadrant, and to make sure you brush the full 2 minutes, and that way you're less likely to miss any areas of your mouth.
And it also lets you know if you're pushing too hard in some areas too,
Exactly.
right?
It gives you a little signal when you brush too hard, a little red arrow comes up and lets you know you need to back off. You're using too much pressure.
That is so cool, and definitely a fail-safe method of making sure you get the cleanest mouth possible.
Exactly. They also pair it together with their alcohol-free mouth rinse. This, of course, will rinse away all the food particles that you've left over after you've brushed. They paired it with the Crest Pro Health toothpaste, which contains stannous fluoride. That decreases sensitivity in your teeth as well as fight off the acids that are caused by certain foods that you've eaten.
That's good. Bad acids, we don't like that.
No, we have the Glide Floss, which is nice and easily guided between your teeth under your wires, and then other brushes that they recommend for cleaning around and in between the braces.
Brushing should be performed after every meal and before bed. Begin brushing in the back on your upper right side. Make sure to apply the bristles of the toothbrush to every tooth and the bracket on that tooth. Slowly progress forward to each tooth up to the front of your mouth, then around to the other side in the back. Drop your brush, then to the lower teeth in the back and proceed around to the front and then other side. Brush the chewing surface of the teeth as well as the tongue surfaces of each tooth. Doing this systematic quadrant brushing ensures that you never miss a tooth or bracket as you brush. Brushing your tongue is important as well to remove plaque on the tongue and freshen your breath. All of these steps help you to maintain your braces and again, help you to remove the plaque that causes acid formation around your appliances, leading to bracket breakage and permanent damage to your teeth. Follow your orthodontist's specific hygiene protocol and ask questions if you don't understand or are having trouble using any of the above suggested products. First of all, let's talk about what plaque is.
Plaque is a soft white material that forms on your teeth after each time that you've eaten. It's made up of the sugar that's left from the foods that you've eaten and bacteria that normally live in your mouth. The bacteria actually digest those sugars and produce an acid. The acid is what can cause damage to your teeth and gums. So your gums can become swollen and red, bleeding, or it can actually begin destruction of your teeth, causing a cavity.
You got to get rid of it.
Absolutely, and it's hard to see because it is tooth colored, so that's why you really have to be careful with brushing and then examining and making sure you've removed it all.
Your orthodontist will be checking regularly at your appointments on how you're doing with your hygiene. A scorecard such as this can be used to help you keep track of areas you may be missing and need to concentrate on to maintain ideal hygiene. You'll be given a scorecard to take home, which will highlight the areas that you need to focus on during your brushing and flossing. Another important factor is seeing your general dentist regularly to evaluate how you're doing on your hygiene during braces and to check for any cavities that may form during your orthodontic treatment. See your dentist every 6 months, even during your orthodontics, for professional cleaning and examination. Now, let's discuss maintenance and care of your braces. During your orthodontic treatment, wires and brackets may rub on your gums and lips as your teeth change positions. Orthodontic wax will be very handy to help coat those areas to make them more comfortable as your mouth adapts to these new appliances. To place the wax, pinch off a small piece, roll between your fingers to shape it into a small ball, and then push the wax against the area, molding it to the bracket or wire that coat and cover the spot. Now, this may have to be repeated during the day, especially after eating. Protecting your braces and teeth can be achieved by wearing an orthodontic sports guard. Damage to your braces by trauma to your mouth during sports can bend and break your appliances, causing tooth damage and undesired tooth movement. Inform your orthodontist immediately if you experience trauma to your braces. Some changes in your diet will be required during braces. Avoid hard and sticky foods that can bend and break your braces. Ice, nuts, hard candy, suckers, crispy fried foods, hard breads, taffy and sticky candies like bubblegum are things you should definitely stay away from during your braces. Citric-based soft drinks and some power drinks contain acids that again will eat away at the glues used to hold your braces to your teeth and cause bracket breakage. You should also cut up fresh fruits and vegetables like apples and carrots to avoid undesired pressure on your braces and wires, which will cause them to bend and break. Don't worry though, there are plenty of foods and sweets that are safe to eat during your orthodontic treatment that won't cause damage. Just ask your orthodontist or their assistants. Hygiene during your retention phase of treatment is also very important. Cleaning around fixed appliances after treatment, like lingual arches and bonded retainers, is vital. Your orthodontist will instruct you on flossing techniques to maintain perfect cleanliness. Rubber tip stimulators are also an accessory to help you reach around your fixed appliances during retention. Removable retainers will also need proper cleaning with the toothbrush regularly. Each time you remove your appliances, brush them and place them in a safe retainer case. Never wrap your retainer in a napkin, as it may be accidentally thrown away or broken. You can achieve your ultimate smile by following your orthodontist directions in these areas: proper hygiene with the suggested home tools, regular appointments with your general dentist for cleaning and examinations, proper maintenance of your braces and appliances by following your orthodontist recommendations regarding the appropriate meals and snacks to eat. Use of wax and sports mouth guards also help protect your braces. Proper cleaning and care of your retainers. Keep them stored in a protective retainer case whenever you're not wearing them. Following all of the above tips will help you achieve the ultimate orthodontic results and an amazing smile for life. Goodbye.